Hello,
Hello.
Faisal. Hi there.
Hello, sir. Good evening, sir.
Good evening. Good evening. कैसा है? क्या हालचाल?
ठीक हूँ, sir. I'm good. How about you, sir?
Okay, good, good. Nice, nice. So, how's everything there at your side?
Yeah, fine, sir. Everything is
Okay,
fine.
great. So, how was your day at work?
Quite tiring.
All right, good, good. Okay, just give me a minute. Okay, let me just check. Yes, this is on YouTube. ठीक है.
Yeah.
Great. Okay, so you can try sharing your slide now, Faisal. Let me
Yeah.
just.
Host disabled participant.
Yeah.
Disabled from your side, I guess.
Yeah, just a minute. I'll just make you the co-host. Yeah.
Yeah.
Hmm.
Yeah. Got it.
Hi, Dr. Deepak is here. Hi, Deepak. How are you? How is everything?
I'm fine, sir. How are you, sir?
Okay. Nice, nice. Good, good. All good. All good here, Deepak. So, how is PG going? What's keeping you busy now?
Also, I'm busy with my busy with
Seminar?
LD and JCs.
Okay.
Also,
All right.
JCs.
ACs. Okay. Good, good. All right. We also have Dr. Kainath there. Hello, Dr. Kainath. We have Dr. Aromal. Yes. Good. Quickly, if you could say a hi. Okay. And we also have a couple of them watching this on YouTube. We just wait for a couple of minutes, Faisal.
Sure, sure, sir.
Okay, I'm just anticipating. All right.
Good evening, sir.
Good evening, Kainath. How are you?
I'm fine. How are you?
Awesome, awesome. Good, good. How's the weather? You must be in Delhi? No, you're in which part of the country?
It's Muradabad.
Hyderabad. Okay, great. All right. Good, good. Nice,
It's
nice to
getting
see.
cold.
Getting colder, huh? Yes.
Yes,
Here
sir.
we're getting more and more rains, and there it's getting colder by the day.
Okay.
Good, good. All right. Chalo. As long as y'all are safe and working good, I think that's what is really important.
Yeah, true.
Okay, so let me just welcome everybody aboard to PhD 101 National Online Learning Series. Very good evening. Today we have with us Dr. Faisal Noor Ahmed. A little bit about Dr. Faisal here. Dr. Faisal completed his master's in public health dentistry from Kotiwal Dental College and Research Center, Moradabad, UP. And previously, he's also done his BDS from the same institute. Now, someone about Faisal, I think, let me just keep this a little informal. I would, give the dentist perspective about Faisal. That's what he calls himself on his Instagram handle. Who does things a little differently. I've noticed the penchant that he has for various domains of public health dentistry. And we would just happen to discuss over one of these topics. And that's how we stumbled upon today's topic, which is oral health literacy. Now, oral health literacy, guys, for all the PGs and everyone who have joined us here and who will be watching this as well much later on, is an extremely important part about how we put forth the public in public health dentistry, because a lot of it revolves around effective communication and messaging and putting across the right portal of communication for the relevant conditions. Now, being public health dentist, we do deal with the grassroots level workers. We do have a first level of contact with the population, and it becomes imperative for us to know the most effective and the efficient means. To shed more light on this, I'm really very happy to introduce Dr. Faisal Noor Ahmed to our PhD platform. Thank you so much, Dr. Faisal, for taking up this session for us. And I'm sure we will be benefiting a lot from the various amount of literature which you have compiled for us and will be sharing us over the next 45 minutes for us. Thank you so much and welcome again, Faisal.
Thank you, sir. Thank you so much for having me here. And it feels really amazing to be a part of public health online series. Good evening, everyone. As we start, public health literacy is a stronger predictor of person health than age, income, employment status, education level, and race, as it is said by American Medical Association. Poor health literacy is stronger predictor of person's health, apart from age, income, and everything. Now let's start with basic things, that is health literacy levels, starting with the three distinct levels in health literacy, which are functional, interactive, and critical. Function is what basic skills in reading, writing necessary for effective functioning in health context. Interactive means more advanced cognitive learning and social skills that enable active participation in healthcare. And in third part is critical, that is ability to critically analyze and use information to participate in action that overcome structural barriers to health. Now, moving on forward, let's understand this diagram of basic health literacy and health knowledge, how they are interrelated to each other. According to the figure, a person with general health, general literacy, ability to understand health information, the first box, and the ability to understand health information and ability to access health information is expected to have high level of health knowledge. These all three contribute to they are expected to have high health knowledge, high level of health knowledge. And second point is basic health knowledge will possibly increase the interest in receiving health information, and at the same time, interest in getting health information is expected to increase health literacy. And health knowledge will help an individual to participate in shared decision making in healthcare. By participating in shared decision making, the existing level of health knowledge is expected to be increased with the help of healthcare providers. And fourth, thereby a person with high level of health literacy, a person is having high literacy will have healthy behavior. Of course, their attitude will change towards looking on their life, and also they will self-manage disease more appropriately than a low literacy person, and participate well in shared decision making. That's all about it, the basic diagram and the basic outview of this health knowledge and how it is related with health literacy. Starting with, health literacy is essential for successful access to care and use of services, self-care and of chronic conditions, and maintenance of health and wellness. And health literacy is fundamental to healthcare that requires individual to have a more active role in decision and management. Now, what is oral health? We all know the definitions and everything. I'll quickly tell you. It is a state of being free from chronic mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal or gum diseases, tooth decay, tooth loss, and individual capacity in biting, chewing, smiling, speaking, and psychosocial well-being. This was given by WHO, and it is one more, Federation Entire International, it's also given one definition. We'll move on. Further attributes of oral health. It is fundamental component of health. Oral health is a fundamental component of health, physical and mental well-being. It exists along a continuum influenced by the values and attitude of people and communities. It also reflects the physiological, social, psychological attributes that are essential to the quality of life, and it is influenced by a person's changing experiences, how well he learns, how well he knows about oral health, and expectation changes, and the ability to adapt to the circumstances also changes. Now, starting with the oral health literacy, it is a new imperative for better oral health, as health literacy is now considered as a determinant or cause of health. The complexity of both verbal and written oral health communication creates a significant barrier to improving oral health. And oral health is integral to overall health and well-being. We all know this. And with poor oral health and untreated oral condition, it will have a deleterious impact on quality of life, how we live. Preventable and treatable oral diseases remain widespread, particularly amongst poor and undeserved population. Like, for example, if we see poor general literacy, and in particular poor health literacy, skills are recognized as possible cause of health disparities. For example, if we see individuals with limited literacy rate, maybe they may be less likely to become active participant in healthcare choices, that is referred to participatory decision making, and may face significant barriers in navigating the health system, like the maids who are working in our houses, or the workers or the frontline workers. They might be not having more appropriate knowledge about vaccine, about COVID vaccine. So we might tell them, we might help them to book a slot in nearby hospitals, and we could help them out. In the oral health context, oral health literacy can be considered as the skill necessary for people to understand the cause of poor oral health, for person to learn and adopt fundamental aspect of positive oral self-care behavior, to communicate with oral health providers, and if they are visiting to a clinic, they should fill out necessary forms, whichever they are providing, and to comply with any required regimes, including follow-up appointments and compliance with prescribed medications. Uh, Now we see that in many dental instructions or in clinics or brochures which we read, they have a level of sophistication beyond an average patient reading ability. It's so much of full of English or full of scientific words. It is suggested that complexity of both verbal and written oral health communication creates a significant barrier. अब समझ में ही नहीं आ रहा किसी को तो वो बैरियर ही बन जाएगा ना, कोई इंफॉर्मेशन प्रोवाइड कर रहा है लेकिन वो जो पढ़ रहा है उस तक पहुंच नहीं रही है. And that oral health literacy is required in order to promote oral health and to prevent oral diseases. और वो fulfilled ही नहीं हो रहा है. On the other hand, quality of life assessment is being regarded as an essential component for assessing outcome of healthcare. Quality of life assessment is also necessary. Like for example, it is seen in outcomes for public health programs. And the impact of oral diseases on quality of life is very obvious. We all know that it is directly proportional. The concept of oral health related quality of life is significant to all areas of dental health, including clinical practice or dental education and dental research as well. The link between low health literacy skills and poor health outcomes has been well established. The question is why health literacy is important. Its simple answer to the question is that poor or those who are poor or low health literacy, it contributes to diseases. The mismatch between literacy skills of individuals and the demands of oral health services may erect an unnecessary barrier to prevent care and treatment. The pathways between literacy and health outcomes are being examined in recent years, and the body of literature linking literacy to health continues to grow. Like, for example, the problem with limited literacy is greatest among older adults because the gap in the new education or new information to with older adults have increased, and those who are poor or people with limited education or minority population. Although education and income arguably remains the strongest correlates of oral health and disease, literacy is one of the numerous other distal determinants. Like oral health literacy may be part of casual mechanism that leads to worsen the oral health. Now, the healthcare provider should need to become far more knowledgeable regarding oral health literacy so that social and cultural factors that influence oral health can also be addressed. Now, in Indian scenario, basic awareness of oral health issue for many Indians may be quite limited because of cultural and language barrier or problem with literacy. Many Indians lack understanding and awareness of the importance of oral health and its essential relationship to their overall health. Like lack of access is result of many factors. Like for example, patient perceived need for care, lack of oral health literacy, geographic distribution of dentists and dental teams, economic disadvantage, or individual with physical abilities that he is not able to visit the dentist, or mental health challenges. So it is important that government, dental profession, or ITA should work together to break the many barriers to oral care access and make them available to everyone, to the public, basically. What is the association between oral health literacy and oral health outcome? Literacy का क्या फर्क पड़ता है oral health outcomes पे? Researchers have built up a causal pathway linking oral health literacy to oral health outcomes. It is believed that low literacy directly relates to less knowledge about oral health. It was seen from researchers that low literacy level is directly proportional to less knowledge about oral health, which leads to a decreased adherence to positive healthy behavior. Moreover, increased health literacy is associated with better patient-dentist communication, which can contribute to lower dental anxiety and thus an increased likelihood of seeking dental treatment. And also the socioeconomic determinants and lifestyle choices such as unhealthy eating, they also affect inadequate personal hygiene, lack of oral hygiene practices, inadequate sanitation, insufficient exposure to fluorides, tobacco and alcohol dependence. They are also the risk factors in determining the health and quality of life. For horseman and cleanman, oral health literacy is the paramount because these two scientists have came to a conclusion that oral health literacy is paramount because low health literacy contributes to the spread of diseases, which result in increased cost to the population in general. And those with low health literacy are usually at the high risk of oral disease. According to a conceptual model of Mack et al., one's general literacy and knowledge of health modulated by socioeconomic and demographic variables can generate appropriate oral health decisions that will impact on health outcomes. He gave this model, and moreover, health literacy is one of the strategies of health promotion according to Nadeem. These two scientists have proposed a conceptual model about health literacy and how it affects the general population, how socioeconomic and demographic variables have affected. The increase in health literacy has potential to promote better decision. If they are more educated, if people have more health literacy, they can take decision more accurately based on information, reduce health risk, increase prevention and well-being, and increase transit through health system, generating patient safety, patient care, and quality of life. What are the guidelines and resources for oral health material to improve oral health literacy? There are some guidelines for starting with oral health information. What should oral health information contain? It should be accurate, it should be accessible, and it should be actionable. What do you mean by accurate? It should be accurate in a way that people can understand. This is basically this thing. Accessible, it is like if we are giving information and people can't use it, it's of no use. Like it should be how you are presenting your information. Is the font large enough? Do you use subheadings or bullet to chunk the information? Do the images matches the text? And where are the distributing your information? These all are accessible parts. And actionable, it is like in human nature, it is a human nature to want to tell people all we know about something, but that doesn't necessarily help, which means that in health field we typically want people to stop or start doing something, or to do more or less of something, like smoke less, eat more, brush daily, like this. We often spend our resources giving people background information instead of recommendations. बेसिकली एक्शनेबल का मतलब ये है कि कोई रिकमेंडेशन दें, सिर्फ बातें नहीं बताएं. Some recommendation like some background information may be important, but make sure you provide actionable information so that people you want to reach can do something with the information provided. And if we are creating oral health material, what points should be taken into mind? Following are the tips for deciding what to say and how to say it, so that audience will understand, remember, and act on the information. Give the most important information first. Second, limit the number of messages to no more than 3 or 4 main ideas per document. Tell audience what they need to know and clearly state the action you want your audience to take. And last, tell your audience what they will gain. And choosing words, what words we are choosing, not just as Instagram captions. We should choose words very carefully, like using word with 1 or 2 syllables when we can. Communicate if you are talking to a friend. Respect and value your audience. That's very necessary. And do not talk down or preach on them. Use a tone that encourages the audience. Limited use of jargon, technical or scientific language. Choose word with single definition or connotations. Be consistent. Use analogies familiar to your audience. ये नहीं कि नई analogy कोई निकाली. Familiar analogies if you are using. Avoid unnecessary abbreviation and acronyms. Limit the use of statistics and use general words like most, many, half of the population, most of the people, like this. Limit the use of symbol. Limit the use of quotation marks. Then words choosing of words are very necessary in providing oral health material or oral health literacy. And if we are developing effective print material for low literacy intended audience, what should we keep in mind? First, it should include only the information needed to convey the behavioral objective and support the intended audience in attaining it. Second, organize topic in order the user will use them. Third, group information into chunk with clear ordered format. Fourth, respect the intended audience. Fifth, follow some guidelines like writing in active voice, giving examples, give the reader an action step like call your clinic, send in request. इससे क्या होता है? This tend to improve retention of information. Retain ज़्यादा time के लिए होती है and encourages the reader to begin practicing the desired behavior immediately. And we have to pretest all material with intended audience as well. For example, I have given the example from WHO e-posters. Like they have targeted their audience very clearly. They have reduced the information into chunks, and they have also given recommendation like what you have to do, what you can do, like remember your shopping, keep your shopping time short and make a list, like everything. They have made it in a concise way. And the use of social media is very necessary. Starting with a video, I want to show you a video. Let me just get it. Just a second.
This episode, we will address
Everyone
public
can
health
see,
messaging.
so is it visible?
Pandemics,
Hello.
Yes.
Okay.
including the recent COVID-19 crisis, has shown how personal and public health are interconnected.
This is a video of only 4 minutes, so bear with me, okay?
Individual safety is dependent on the behaviour of others. Changing public behaviour has never been easy. It requires leadership with clear, consistent messaging. If the messages are mixed or inconsistent, public trust is lost and anger takes its place. Misuse of language and misunderstandings abound in many areas of public health messaging. Major non-COVID public health challenges of our time have been confounded by mixed messaging and confused policy. A recent example was the failure of health authorities and the media to explain the distinction between screening and diagnosis of disease. This confused public debate and undermined confidence in many screening programs. Simply stated, if you have symptoms, you need a diagnosis, not screening. Screening is for people who have not yet developed symptoms of disease. It's not about diagnosing people who are ill. Long before COVID-19, the increasing resistance of bacteria to antibiotics, along with a diminishing pipeline of effective new antibiotics, was declared a public health emergency. But how many people knew this? Control measures have been feeble, in part because the language used to describe the problem is unclear and lacks urgency. Surveys have revealed remarkable misconceptions among the public, many of whom think it is the person rather than the infecting organism which becomes resistant. Furthermore, the lack of urgency of public health messages regarding antimicrobial resistance is shown by the failure to clarify that antimicrobial resistance may be highly contagious and spreads from patient to patient in overcrowded, poorly designed hospitals. If the infectious nature of the problem were explicit, the threat to everyone would be appreciated and the response more urgent. Flawed language also contributes to the ineffectual campaigns addressing other public health dilemmas. In some cases, public health ventures have reinforced rather than reduced the stigmatizing effect of illness. For example, bias against people who are overweight is widespread throughout society, including the health service, and patients are reluctant to attend medical appointments when they feel stigmatized by a doctor's language. No one should be defined by their illness. As one of the biggest health problems in society, one might anticipate that obesity would be tackled with a concerted, well-planned, multifaceted strategy for management and prevention. Not so. Instead, there has been a stream of mixed signals, misleading messages, incoherent policies, and siloed thinking.
Let me share one more. Just a minute.
The problem is confounded by misinformation. An infodemic is how the World Health Organization described the challenge. The infodemic accompanying the pandemic is a flood of information which needs proper interpretation and disinformation which needs to be fought. Trying to convince vaccine deniers of the safety and effectiveness of immunization is like trying to debate with conspiracy theorists, flat earth enthusiasts, and those who insist that Elvis is still alive. Logic, science, and repeated medical assurance of safety seldom shift their opinion. Facts don't work, but people's stories might. Research with other infections, such as measles, shows that real stories of what happens when vulnerable people become infected may have some impact on vaccine hesitancy. Public health narratives need to convey the message that public health only works for the individual if it is a collective enterprise, and fears of vaccines need to be supplemented and supplanted by real messages of what happens to real people when real diseases are allowed to spread.
Now, what we know about this, that social media or the messages we use that are not up to the mark, or they are using fake messages or wrong messages that are going or circulating in the media or in the public. So social media is very important. The use of social media like Instagram, Twitter, or Facebook, whatever, WhatsApp, it's very important how the information or how the information is circulating. Over the last several years, the use of Facebook, YouTube, Twitter, and other social media tools to disseminate health messages has grown significantly and continues to trend upward. Use of social media tools has become an effective way to expand reach, foster engagement, and increase accessible to credible science-based health messages. Integrating social media into health communication campaign and activities allow health communicators to leverage social dynamics and networks to encourage participation, conversion, and community, all of which can help to spread key messages and influence health decision making. And social media also help reach people when, where, and how they want to receive health messages. It improves the availability of content and may influence satisfaction and trust in health message delivered. Now, moving on to the next part, that is health literacy toolkit. Few of the health literacy assessment tools that are most commonly used in medical practices are Realm, Realm 1991, that is used for word recognition test. Realm 1993, it is a shorter version of Realm. Test of functional health literacy in adults, which helps in reading comprehension and numerical ability. And NVS is newest vital sign. It is literacy and numeracy skills. Now, if effective communication tool, if we need for healthcare professionals, what is that? We will see it. This is a free online training program developed by US Department of Health and Human Services to improve patient-provider communication skills by increasing awareness and knowledge of the three main factors like health literacy, cultural competency, and limited English proficiency. Health literacy, how to addressing low health literacy and bridging knowledge gap that can prevent patient from adhering to prevention and treatment protocol. Cultural competency, like acknowledge cultural diversity and deal sensitive to, cultural differences. And English proficiency should be limited, accommodate low English proficiency or Hindi if you are using low Hindi proficiency, and effective use tools that do not rely on written or spoken words. Now, gateway to health communication and social marketing practice. What is health communication and how are they common? Health communication and social marketing share a common goal of creating social change by changing people's attitude, external structures, and or modifying, eliminating certain behaviors. Like products, program, or intervention are created and used to promote health changes in individuals and communities. New products, if they are coming, or any new program, health program is coming, or interventions like COVID vaccinations, they are created and they are used to promote health changes in individuals and communities. Health communication uses multiple behavioral and social learning theories and models to advance program learning and identify steps to influence attitudes and behaviors. Now, health communication can take many forms like verbal or written. There are many strategies that are used for effective health communication. For example, if we should first start with reviewing background information to define population. What is out there? Now, setting communication objective, like what we want to accomplish. Third, what do we want to reach? Like analyze or segment target audience. Fourth, what do we want to say? Fifth, what do we want to say it? Where do we want to say it? Select communication channels, how we are going to channel our information towards people. Sixth, how do we want to say it? And seventh, how do we get it used? And lastly, how well do we do it? Outcome should also be there. Na? Now, public health literacy, coming to the last part of the topic, it is socially, spatially, and temporally located. It consists of various types of knowledge and skills, including experience and oral tradition, as well as reading, writing, arithmetic, and higher education. Like public health literacy is as much citizen based as it is expert driven. And it can take multiple forms, from voting to organizing grassroots initiative to establishing health policies and structures, or the target population for promoting health, public health literacy is the entire public, not just like the public health or medical official. It's the target population is the whole of the public, the world, basically. The competencies within each dimension are not hierarchic, but rather summative, which means that the greater the number of competencies, the higher the level of public health literacy and the greater the capacity to improve public health outcomes. And what are the pathways for this public health literacy? First is that effort ought to focus on formal education system, like in schools, in elementary, starting from elementary schools to four-year colleges or universities. This type of training would aim at preparing people to become not necessarily public health professionals, but rather more informed member of the public. जरूरी नहीं है public health members ही professionally बने, but they should be a civilized or a person having complete information, and thus prepare students to effectively address public health concerns from myriad perspective. Like if they are going to work, or they are voting, or they are becoming a parent. This type of example of this approach, they are already being developed. Second is there is a need of increased level of public health literacy among the public at large. This increase may occur through media, example newspaper, magazine, television, radio, along with community-based or work-based initiative. And thirdly, the targeted training program, like for efforts may be targeted a specific health concerns such as childhood obesity, and then work to ensure relative stakeholders. Example, training program for school administrators, for grocery store owners, legislators, and media that are provided with opportunities to become more public health literate. These three-dimensional outline in previous slide may be useful in development of effective assessment instrument that would identify the extent to which individuals and groups are public health literate. Research would also explore the relationship between individual level health literacy and public health literacy as a whole. Efforts should be made to promote the incorporation of public health literacy into health literacy program, formal education system, and informal education networks. What is the take-home message? If you see, a responsive health system that eliminates barriers, leading to a clear communication and provide usable and actionable health information and services is important. Providing everyone with access to accurate and actionable health information, delivers person-centered health information and services, supporting a lifelong learning and skills to promote good oral health, good health, of course. Key organization and professionals play a critical role in developing and disseminating health and safety information to public and profession. Print, audio, visual, and electronic media is also important. Health education at home and in schools is also important. And for communities, starting a health column in local newspaper or creating a health program on local radio or cable access television, where we can invite local doctors or public health officials, educators, and community members to participate and discuss. Few of the health literacy program in India, starting with Kalyani, it was initiative by Ministry of Health and Family Welfare by Government of India, and program was broadcasted over Doordarshan. And fun fact about this program that it has been nominated for television Oscars as well. Theme of the television program was reinforced by in community effort like reproductive and child health care, malaria, tuberculosis, HIV/AIDS. Knowledge of these areas among viewers of the program compared to non-viewer is consistently higher. As of 2019, this effort is reported to have produced more than 9,000 programs in 5 languages and 14 dialects. Another program, another academy, or you can say program, was Darpana Academy. It was founded in Ahmedabad by Vikram Sarabhai, the famous physicist. It is an art center where arts meet society to inform, educate, and transform. Like they uses Indian dance, puppetry, music, theaters, television to educate, empower, and raise awareness about critical issues facing in India. Health issues that they have covered are family planning, diabetes, cervical cancer, HIV, AIDS, and all that. Now, Public Health Foundation of India, it is a public-private initiative that is reported to have conducted community-based health literacy campaign to effectively build engagement and facilitate action for improved health outcomes at the grassroots. The organization has conducted health literacy assessment and research projects on increasing health literacy at grassroots, relating risk factors and symptoms of selected chronic disease prevention opportunities. Many campaigns conducted so far have reportedly use of mass media through community and commercial radios, newspaper ads, participatory mid-level media using songs, street plays, puppetry, public meeting, dance as well, and interpersonal communication through peer education via cascade approach. Many of the program and e-learning program, you can check their website. They have e-learning program and training program as well. The SEWA, the Self-Employed Women Association, it is a trade union of nearly 1 million self-employed women in Gujarat, India, SEVA has collectively organized health insurances to pay for health costs, organized childcare, centers for infant and young children, and campaigns with state and national level authorities for childcare as an entitlement for all women workers, basically female oriented. The SEVA trains traditional midwives so that they become the barefoot doctors of their communities for helping to promoting the health and well-being of by providing access to health information and health education, provide basic amenities like sanitation, illiteracy, and other developmental skills, and emphasizing self-reliance of women for in economic terms and in terms of women themselves owning, controlling, and managing their own health activities. Now, I would like to conclude on a point that oral health literacy is increasingly described as a currency for improving the quality of oral health care and overall health as a whole. It is the basic reading and numerical skill, which means that it allows a person to function in healthcare environment. And as a health profession, dentists have a responsibility to ensure that health information and service provided are easily understandable, accessible, and people are able to comprehend and apply those recommendations. If they're not able to apply those recommendations, then it's not useful enough. I have made a list of references. You can see them and track it. Thank you, everyone, for hanging by.
All right. Great. Okay. Thank you so much, Dr. Faisal. I think this was a very informative and a very relevant topic, I must say. The reason why we took up this session was to make sure that we'll be able to sensitize a lot of our postgraduate students and undergraduate as well. So quickly, I think if we have time for some discussion, yes, okay, I'd like to open the house for discussion. Yes, you can please go ahead, please raise your hand, or you can unmute yourself and ask Faisal for questions. Yes, Dr. Deepak, go ahead.
So my question is, as being a public health dentist, what do you suggest? Is it the low? You want the community to be oral health literate or oral health educated? So you got my question, sir.
Can
Hello?
you repeat? Oral
Yeah, can you please repeat, Deepak?
Yeah.
It's like as being a public health dentist, what do you want our community to be? Whether you want the community to be oral health literate, or it is, or you want the community to be oral health educated.
Okay, Faisal is asking about the difference education and literate.
Education and literate. Yeah. Education is necessary. First of all, education is very necessary. If people are not educated, they won't understand any knowledge if you are giving. So I think education is important before getting literate. What I think.
Yes, yeah. I also just adding a point there. Deepak, to your question, right? I think once we cross the first barrier to that, right, we need to provide information which is being able to process by the population. Okay, only when they become knowledgeable about dentition, common oral conditions, and how to prevent them and what steps they can do. Literacy is to make yourself as an enabler in the system, like what Faisal illustrated through various mechanisms here. I think it looks at the larger perspective here. So it's more like health education, health promotion, right? So we are on the way to that. So that's just a little bit of points I'd like to add.
Facilitator.
Yeah, I'm sorry, we couldn't hear you. Yeah, please, can you repeat?
Are they like facilitator?
Yes, right. You mean to say,
Okay.
how do we function as facilitators?
Working as a facilitator, sir.
Yes. Now, yes, Faisal, you want to go ahead and answer that? How do you form a bridge between?
Yeah, first we can start with the basic. Like if we are educating someone, like education is necessary, I must say that. But basically, the education and literacy comes later. Like if public health dentist is, if we are going somewhere, we should know about the literacy of that area, or if we are telling someone, then we should know the literacy level of that area. then only we can provide good education or knowledge to that.
Yes. Yes, Deepak. Just to add on to what Dr. Faisal mentioned, the role as a facilitator is in fact defined as one of the core competencies what you need to possess as a public health dentist. Okay. Now, the role of a facilitator is not just passage of information, it's also to put things into place and to ensure a smooth flow. All right. So the role of public health dentist is definitely goes beyond just being a mediator or anything of that sort, right? So we must be in a position and enable, be it a legislation on tobacco or be it creating awareness about early childhood caries or even conditions where fluorosis or requires some kind of social measures. So it is a very, very important role, which I think is the broader perspective, right? So that's absolutely fits in place there.
Yeah.
Okay, sir.
Yeah.
Thank you.
Yes, Ariba, go on. Yeah.
Good evening, sir. It was an amazing presentation. Sir, I wanted to ask how to tackle the misinformation at the grassroots level. Like, as we are postgraduate students, right? So we have like undergraduates, and then we have students who go to school, or we have people who are not literate, who work as a house help, who works as a driver. So they don't have access to information have like we are directly getting information from, and in India there are very large number of people who are like who are not educated, like they cannot read and write. So how to like tackle misinformation at the grassroots level, like people who cannot understand things.
Okay. Yeah. Thank you, Ariba, for that question. I mean, I see it as two questions within one. One is you want to know how do you tackle misinformation about oral health or literacy, right? And second thing is
Yes,
for people who are starting off with no absolute base value, right? Without
yes,
any
sir.
prior information. How do you, yes, Faisal, please.
Yes, sir. I would like you'll explain in a better way.
No, go ahead, go ahead.
I can.
Give it a try. Yeah, go ahead.
Yeah. For uneducated, I don't have any point to say, because how can you give them brochure, or how can you give them read to things, and you have to explain them from the very basic. And for starting, and after, if they are going to schools and if they are school going, then it's not a problem. But for, if Ariba is asking for those who are not literate, if they are not going anywhere, then I think we have to start from the basic and explain and deliver some solid things to them.
True. That is absolutely, yeah, one of the points thing. Okay, let me just add a little bit of that. I think, oh yeah, we have Dr. Anita here is here. Yes, Dr. Anita, please. Dr. Anita from MS Ramaya University. Yes, ma'am, please.
Good evening, everyone. I'm just returning back from the inspection. Sorry, I couldn't join. I joined a little late. This
Please.
area is something very interesting. So, adding to the answer what Faisal told, with the little of what oral health literacy that we have worked for, if a person is uneducated, we can go with the pictorial representation of the information that you're planning to give them. So that is possible. The whole concept of literacy, health literacy, is indeed that, create that literacy levels to different levels, from basic level, then to functional, basic or functional, and then applied, and then the critical. So I think you can give pictorial information. There is nothing wrong. That can be the point for even the non-literate or whatever. Those who are illiterates, basically, those who are illiterates also.
Okay. Thank you, ma'am. I think usage of pictorials, I think, sort of overcomes the barriers of any language or comprehension. So I think it can be used very effectively. In fact, as a mode of communication, it is one of the most effective means. So yes, we could do that. Anita ma'am, if you could just share your experience about when you've dealt with oral literacy models, or is there anything which you could add on to the presentation, ma'am?
This is just a little small research that we undertook. We developed a oral cancer literacy tool, which was first of its kind. We did not have an oral cancer literacy tool. So we did have many other tools, but related to oral cancer, it was not there. So it was very daunting. We picked it up and we took a mixed method approach along with a postgraduate student, and we were able to develop. But when the research was going on, the postgraduate was not able to understand what is the use of innovative or going this kind of approach, developing a tool. There was always a murmuring, there was always a cribbing why we should develop at postgraduate level, why not PhD work be done to this level. But trust me, when she went for ICMR interview amongst 130 plus people, there are overall 1,000 plus interviews, and in her batch around 130 plus people were there. When she explained the whole process, how the development happened and everything, she was the first person to get the order of her job. She was there for 5 years of contract with ICMR, and she worked. She was working with the cancer literacy, cancer team, cancer research team. They just picked her up just because this novice attempt was taken and it was done. And as a word of gratitude, in return, she came back, she met, and she published all her work. So this was a little experience.
Yes, ma'am.
Related to oral health literacy, here we don't give importance basically. We have to start emphasizing a lot on. It matters a lot indeed.
Ma'am, could you just give us like a brief, like what were the components, like if anyone wishes to do that, where do you start and how do you assess, like just like a sneak peek into that? It sounds very interesting.
The beauty about research is you can start from where you are. We are not researching. With a conscious mindset, if you go on searching with the inquisitive mind, obviously you will be able to do it. I would suggest go ahead and take up something which is simple. Like there are several oral health literacy tools which are already there. So you can take it up, translate it to your local language. I'll share one handbook which is exclusively about oral health literacy, and it is free of cost. I'll be very happy to share it with you, Dr. Zedenzi. So there are many tools which are available. So you can just take it up, customize to your place where you're doing the study, and try for translating it or trying to do with psychometric properties validation.
Yes.
Yeah, you can simple take any tool, customize, and take expert input and assess the oral health literacy levels of the population where you are working. Instead of doing a camp just like that, you can give the questionnaire to the people and let them fill it up, and you check the distribution of oral health literacy. And since you are continuously conducting camp in that area, after 6 months you see how the same tool changes, values changes, after 1 year how it changes, after over a period of time you can assess. Just simple one answer, just take up any tool, oral health literacy tool, assess the levels of oral health literacy. I think that's sufficient enough, and I'll share the PDF copy with you.
Sorry, ma'am. Thank you so much. Thank you, Dr. Anita ma'am. Dr. Anita ma'am, heading the department at MS Rama University for Public Health Dentistry. Thank you so much, ma'am, for your inputs. I think that was really value-added information because we think, of course, like I mentioned right at the beginning of today's session, me and Faisal were having a chat, and this started as something was his library dissertation, right? So Faisal picked it up, and then it sort of intrigued me, and then we thought, let's just get on with it. And I think we're getting many people along, so I think we're definitely going to have more of these related topics. All right. So any other questions from the audience? please to go ahead before we wind up. It's almost 9. I'm really sorry we're eating into
One
your. Yes, yes, ma'am.
Dr. Faisal, how are you
Yes, ma'am.
going?
I'm sorry, ma'am. We couldn't hear you. Could you repeat that?
I just wanted to know how are you taking oral health literacy journey ahead?
Ah.
Ma'am, I'll start using the toolkit now. I'll have to use the toolkit and then assess the quality of life afterwards.
Okay, okay. He's just completed his PG, ma'am. So I think.
Yeah.
Very nice. That's very nice. Coming up and being expressive enough is something really nice. Keep it up.
Exactly. Really,
Thank
really.
you.
I totally second that. I think it's just been 2 months out of post graduation, Faisal. I think you should take this up and
Yeah.
make sure it reaches its pursuit and the potential that it holds. And
Sure,
yes,
sir.
way to go. So thank you so much. Thank you, Anita, ma'am. Thank you for chipping in. As
Thank
always,
you.
you've been
Thank you, ma'am.
really informative and added session, value to the session. Thank you so much. Okay, thank you all, everybody. I think that brings us to the end of this session today. As a moment of, I'll take and appreciate from PhD 101 to Dr. Faisal for giving us the session today. For all the students who will be benefiting from this, and definitely we shall be having more of content in this direction. And like I said, we keep the process of learning going, and that's what we do at PhD 101 is to expand the scope of dental public health in various forms. It's not just we limit to chapters and topics, but then there are various points like this which can start a conversation, could add more perspectives into various dimensions, especially because when we're dealing with the social determinants of oral health, everything in the environment is bound to influence. And given this information era, like we currently belong to, oral health is no outlier to that. And there is got to be a lot of information which has to be processed and understood by the population before they can actually benefit from these programs, and so to say. Thank you so much, Dr. Faisal. Thank you all the
Thank you so much,
participants
ma'am.
for please joining in, and we'll see you all soon at the next session. Goodbye, everyone, and good night.